All right, team, we have a patient presenting with symptoms of pericarditis, infections associated with diseases in Osgood. Schlatter disease?
What diagnosis are we looking at here?
Could it be a severe infection like sepsis due to the various infections associated with diseases?
I'm leaning towards an autoimmune condition like lupus causing pericarditis and other complications.
I think it might be a case of osteochondrosis with Osgood, Schlatter disease being a prominent symptom.
No. It's progressive vaccinia, I'm sure of it. We need to act fast. Prepare for a rhinectomy.
Wait, rhinectomy? Are you sure, Hawks? It's a risky procedure.
I don't know, Hawks. Maybe we should consider other treatment options first.
This seems too extreme, Hawks.
Are you absolutely certain about progressive vaccinia?
I've never been more sure in my life. We're doing the rhinectomy now. Tracy, I need to talk to you about my patient with the suspected progressive vaccinia. I want to perform a rhinectomy on him to prevent further complications.
Hawks, are you sure that's the best course of action? Have you consulted with the rest of the medical team?
I don't need to consult with anyone. I have years of experience in this field, and I know what's best for my patients.
I understand your experience, Hawks, but as your boss, I have to make sure we're following the correct procedures. Let's discuss this further before making any decisions.
This is outrageous, Tracy.
How dare you question my expertise and delay the treatment for my patient? I will not stand for this.
Oh no, this is not good. The patient is in critical condition. I can't believe this happened. I have to break the news to Hawks that the rhinectomy was not the right treatment for progressive vaccinia.
How do I even begin to explain this?
I'll have to find a way to convey this information carefully, without placing blame.
Hawks needs to know what went wrong, but also how we can move forward from here.
What were you thinking? You chose the wrong rhinectomy and misdiagnosed the patient. You nearly killed them.
But Dr. Hawks, we were certain that was the correct procedure to perform. We followed the guidelines carefully.
I agree with Gary. We did our best with the information we had.
Maybe there was a misunderstanding in the patient's symptoms.
We can review the case to see where we went wrong.
You're all a bunch of incompetent fools. I can't believe I entrusted this patient's life to you. You have no idea what you're doing.
We can still work together to figure out where the mistake occurred.
Let's not point fingers and work together to ensure this doesn't happen again.
I think we should double-check our research and findings to correct our error.
I don't have time for this incompetence. Figure it out and report back to me. I'm leaving this room before I lose my mind. I can't believe I haven't figured it out yet. This case is driving me crazy.
Maybe you should try looking at it from a different angle. Have you considered the possibility of a rare condition?
I thought about that, but the symptoms just don't quite match up. It's like a puzzle with missing pieces.
What about conducting more tests? Or consulting with other specialists?
I have considered all of that, Johnson. Just give me some time. I'll crack this case.
Alright, don't get too stressed out over it. Remember to eat your sandwich at least. Maybe it will help clear your mind.
Wait a minute. I think I know what's wrong. I need to go. Thanks for the sandwich, Johnson.
Wait, what? You can't leave me hanging like this, Hawks.
I'll catch up with you later, Johnson. Trust me on this one. I've discovered something groundbreaking. Progressive vaccinia was a misdiagnosis all along.
What are you talking about, Hawks? You can't just barge in here without proper equipment?
This is unacceptable, Hawks. We have protocols for a reason.
We can't just ignore established medical procedures because you have a hunch, Hawks.
Trust me, this is different.
It's galactocele. Prepare for surgery. We need to act fast.
Tracy, thanks for the congratulations. I just wish you had listened to me from the start.
What do you mean, Hawks? I thought we were on the same page all along.
No, Tracy. Remember when I suggested running that extra test last week?
Oh, that test. I remember now. I should have listened to you.
Exactly. If we had done that test sooner, we could have avoided all this confusion with the wrong diagnosis.
I see your point now, Hawks. I'll make sure to trust your instincts moving forward.